lot of implementation science is donor funded. And some of the challenges that we see is we can go to all the roundtables, sit down, identify our national priorities, but if they're not aligned to the donor priorities, then we get most of our questions not answered. The willpower, the skills to do the implementation science research is there, but it just doesn't align with the donors. And so those are some of the conversations. The difficult conversations that we have to have is how do we get the donors to acknowledge that as we are in countries, we are some of the local NGOs, we do know what the gaps are and they can resource mobilize, they can give us the funds for that, not just meeting their own interests, but our own national interests as well. So I don't know what the solution to that is, but those are some of the challenges that we experience.
I think one of the things that we focused on is that the field of implementation science is often focused on the translation of research into practice, rather than, or maybe emphasize more than practice into research. So maybe looking at kind of that continuum and how we emphasize on one rather than the other. So in our experience, we've really wanted to try and figure out what is the user perspective in implementation science? And that tends to be actually the people that we're serving and the teams on the ground that are doing the work. How can we better bring that user perspective into implementation science and help to build from there, rather than kind of the orientation I think that we often have, which is based out of the literature and the evidence reviews, and where we start oftentimes with some of the research questions and the bigger thinking around this field. We also have had quite a bit of discussion around the tools that are used oftentimes by the research teams. So whether or not these are practitioner oriented or practitioner focused, because we've had quite a bit of work around what is feasible, what can we actually do in a 30-minute interaction, whether it's research or implementation in this actual work, and what makes sense and what is actually going to really illustrate do no harm, what is actually going to help us really lift up the lives of the people that are being served, and figure out ways that we're trying to really to improve their context and their surroundings.
Around the area of mental health and psychosocial support, one area that I've been paying greater attention to around capacity building is not just on the interventions themselves, but on how do you integrate those interventions within other service delivery platforms, looking at sort of the systems within which we work. And Gina has already spoken to this, because getting away from the idea that it's just the capacity for individual interventions, such as some kind of, say, cognitive behavioral treatment intervention. So to looking at how do you integrate that within HIV care or integrate that within primary health care. So it makes it more complicated, but it's more real in terms of what we are having to face. Because I'm beginning to feel like we have the evidence, some evidence, not enough, and of course we always need to build that evidence base, but we have evidence for different interventions, but we still don't know how to integrate it within a system of care. And that is to me, the big challenge of the day.
I think more to think about instead of training, have more conversations. Implementers will not change what they're doing unless if they just get given an article to read. It has to be a process of engagement. And when we look at the research results that we're coming back, or the evidence that exists, that would interrogate it within our context, within our realities, and adjust it and work together to develop the implementation science that makes more sense to us in our context. So I think the more conversational approach is key. And then the other thing is just, to also think about specific thematic areas that emerge, and these emerge over time. And so, for example, we're finding quite an increase in adolescent suicide, and then out of COVID, a high rates of adolescent or young and unintended pregnancies. These are huge thematic areas that are emerging, and more information and more knowledge around those things have become key as implementers see them and find them in the context they work in.
Talk a lot about the sort of the technical skills in implementation science, the research and development and designing. Maybe because in our case, it was such a political, environment. The soft skills in implementing and managing change were so salient at the beginning, which means understanding your levers for change, understanding how do you manage change and between institutions. So in a sense, we were doing a lot of organization development, but across institutions. So those were competencies that were super critical for our project, because even before you can get to sort of the technical solutions, we really had to deal with the more strategic issues, which is how do you get buy-in in a government that thinks that the solution to drugs is to kill people. So we really had to work sort of the technologies had to take a backseat to getting buy-in first for the importance of treatment.